Namaskar. Welcome to this special edition of Healthy You and AAPI. And I have the pleasure of welcoming President-elect of AAPI, Dr. Ravi Kolli ji, joining us.
Yes.
Namaste, welcome. Such a pleasure and
Namaste.
honor to have you. So, you are helping people connect with life in the best possible manner by paying attention to their mental well-being. Um, I will also like to connect a little bit of your background with our viewers, with your permission. So, may I say that you have worked with the outpatient mental health and drug and alcohol treatment program in Western Pennsylvania. You have provided care to over 60,000 patients in multiple locations. That is indeed a lot number, and it assures us of the experience which you are bringing for our viewers. And you are board certified psychiatrist with additional qualification in addiction, forensic, and geriatric psychiatry. And you are also a professor, clinical assistant. You have served as clinical assistant professor with University of Pittsburgh and West Virginia University. And there are several organizations that you have been active with. So let us begin with where we are in terms of the overall mental health with so much uncertainties. So before we talk about how COVID and uncertainty of the war situation affects us, let me request you to give the basics of what is it that you consider as mental health.
Uh, Greetings and namaste, and thank you, Ashok ji and ITV Gold for partnering with AAPI to produce this outreach program for the community. Mental health is defined, actually, health is defined by WHO as a complete well being, dealing with all the life stressors, fulfilling our full potential, participating in the community, and contributing to the wellness of the society. So, that is the full definition of physical, mental, social health. So, all these components have to be potentially achieved to be considered as one to be healthy. That's a lofty goal, but that's an achievable goal.
Absolutely. So, what is it that goes into making or breaking of mental health? So, you come across some people who are always happy and they show resilience in the face of adversities, and there are others who would break down even if there is a small unfavorable event that they have to face.
Yes. And mental health, like any other health, has many components. It can be affected by your environment, your upbringing, your culture, and your circumstances, your adversities you face, as well as your own nature, the genetics, the biology of your brain, and your epigenetics, how your genes are manifesting its strengths or weaknesses over period of time under stress or under nurturing and thriving conditions. So we are a product of our nature as well as nurture, and we are a product of our circumstances as well as our birth. And so these are all combination of factors affect our outcomes as a person and as a productive individual.
And Dr. Saab, we are frequently hearing this term emotional intelligence. So there is one intelligence and then emotional intelligence. So how that constitutes into making a person a happy person with sort of a good mental health?
That's a very good question. Actually, I have done some study on that as well myself. Emotional intelligence is a word that became very popular from popularized by Daniel Goleman, books on emotional intelligence. But before that, it has a historical background. Peter Solvay, who is now a dean of Yale University, wrote a seminal article on that along with his partner, and they're talking about emotional intelligence. But before that, actually, Abraham Maslow and other people, Wexler and all those in various intelligence scale, they also added emotional intelligence, social intelligence as a component. So it's not the intellectual or cognitive intelligence that determines your success. It is emotional intelligence that determines your success, both as a leader and as an employee or in your relationship with your spouse or with your family, with your workers. So emotional intelligence has two components. One is your self-awareness. You're aware of your own emotions and where they're coming from and how to read them. A lot of times we don't even understand our own emotions. So the first thing you need to be aware is how to be aware of your own emotions. And then once you name your emotions, you can tame them if needed to be. And the self awareness, self management are the first component of emotional intelligence. And then the next comes the social awareness, how the other person is feeling. That requires empathy, how to read other people's emotions, how to read their state of mind. And that makes you socially aware as well as socially manage the relationship for the enhancement of the relationship and the functioning of you two or as a group of people. If you're aware of the emotional status of group of people you're working with, you have a better relationship with them, you can communicate better with them, you can lead better with them, and you can guide them better. So outcomes are better. The many studies have shown it's not the intellectual intelligence that matters, the emotional intelligence that is actually finally determines your success.
So you mentioned about both sides being aware uh, about how you are feeling. Is that something which can be developed? If many times people feel that, oh, I don't know, I'm feeling bad, but or I feel angry, but they don't know what is causing them
Right.
to feel like that.
Exactly. Emotional intelligence, like any other skill, can be developed, can be improved, can be trained. Like any muscle, you can train. You can train your emotional intelligence muscle as well. And first thing is to pay attention to your emotions and try to name them, because a lot of times we lack vocabulary to describe our emotion, especially in some dialects, some languages may be a little bit limited in their vocabulary. In English, which incorporates many languages, you have many words to describe the same emotions. So you can have very nuanced explanation of your feeling. You can feel sad, you can be depressed, you can be dejected, you can be demoralized, you can be happy, you can be euphoric. So there are hundreds of emotions we can use to describe our feelings. So, but there are some core emotions we need to understand so we have better concept of where we are, how our emotions are.
Actually, in talking about where we are in terms of the world that we live in, and COVID not only caused health issues, it also caused many mental problems. Isolation is something which we are not used to, being social beings. When you don't have enough opportunities to mingle, or if you are not well and nobody can come near you, or you cannot pay visit to someone who is near the last phase of his presence on this planet in the human form. So all this, how it has affected mental health in general. First, let us look at the impact of COVID in America on mental health.
Yeah, that's another important topic I have been looking at: social isolation, its impact on mental health as well as physical health. And as we all know, our lives have turned upside down. With COVID, we not only lost a lot of lives, a lot of livelihoods have been affected as well. As a precaution, we had to physically isolate ourselves in the beginning of the COVID before the vaccination arrived, and we have better protocols for treatment. The social isolation has a severe impact on our well being. And there is a reason for it. For survival, we need social connection, not just now. Our ancestors survived because they are social creatures, social animals. For a child to survive, it needs more than just parents, a community, a village to protect the child. Because a human infant is very vulnerable. When a child is born, it is not the infant is not able to survive on its own for at least 2 years. It needs a lot of eyes and a lot of hands to nurture him, protect him. Unlike other species, for example, a deer or a bird can be born and fly and run in a minute, but whereas the human infant cannot. So the social embedding is very important for survival. So that survival process, even though we don't need that level of protection from community, the social connection is embedded in our brain. When we are socially disrupted from these connections, the pain is real. The emotional pain we feel from social isolation as real as physical pain that has been shown in the brain studies where emotional pain is also can be mapped. So the social connection is so important, and isolation is so disruptive to our emotional and physical health. Many studies have shown social isolation increases health risks. Actually, as a matter of fact, 50% of the elderly population are socially isolated. For that reason, United Kingdom and Japan recently started ministries called loneliness ministries. They're implementing social programs to connect people, to especially senior citizens and disabled people, to be connected to some program to enhance their life and quality of life. So it's very important that we connect socially. And there is a social contagion effect. Not only social isolation is disruptive, social connection is enhancing your health. If your friend lives 25 within a mile of your where you live, you have a 25% likelihood of being happier along with him. And if your neighbor is your friend, you have a 35% likelihood of being happy. These are proven studies. They have been published in Lancet and British Medical Journal
Yeah.
and
So,
various other
yeah, I, I'm
scientific.
I'm I'm tempted to interrupt you because like two sides of the same coin. Sometimes people feel that because they have so much people around them, they don't have enough me time, as the term has become popular now. So there is probably a need of a balance between the two, that you mingle, but you have time for introspection and to be with yourself. Is
Correct.
that right?
Absolutely. A lot of times, just because we are surrounded by people, it doesn't mean that we're connecting with them. Social isolation is a subjective thing. Loneliness is a subjective thing. You can be around a lot of people and still be feeling lonely. So, whereas social isolation is objective, social loneliness is a subjective feeling. So, you can be around people and be lonely, or you can be alone and be happy because you have one solid relationship that's good enough, and you have a few solid relationships that are good enough. So, and like you said, harmony and balance is so important. Isolation, so self-reflection, meditation, self-awareness, these are all important part of kind of bouncing back, bouncing forward.
So now, looking at the mental health issue from the global perspective, and especially in the context of India, and as um president-elect of AAPI previously, also you have engaged with issues that are of concern for Indians, and you have collaborated with several organizations, as I know. So, talk to me about, was there any basic difference between India and America as far as COVID impact on mental health of people is concerned?
Definitely, culture determines our outcomes many times, both positively and negatively. And generally, Indian people have more family connections and more spiritual connections, more social connections to kind of feel more empowered. And but also at the same time, we have a lot of barriers. We have a lot of poverty, a lot of lack of resources, enough personal space. So physical isolation may not be easy. The protective equipment may not be available readily. So there are some strengths and weaknesses in each culture, and it definitely affects your mental health and your physical health and your risk and your protection from illnesses. So those are the factors that play a big role both here as well as in India.
And Dr. Raviji, most of our viewers are here, Indian Americans, of course, others as well. But looking at mental health issue that you feel might be additionally challenging for Indian Americans or diaspora who now feel acute sense of reality on their threshold, that anybody may go any day. That kind of wave pattern circulating around us, especially post COVID, and not being able to visit India or your native land. And so, how that uh, affected people here, and based on your experience of having interacted, was there any different additional layer of challenge for people?
Definitely, our lives have been put on a pause and a hold We could not celebrate life events, milestones, marriages, graduations, and various other important things that we celebrate, because celebration is part of life. So again, celebration is bringing people together for a positive experience. The sharing and the celebration actually enhances your emotional health. That's the reason for festivities and celebration, to bring people together, to kind of reminisce and nostalgia. These are all positive health factors, mental health wise. So these are disrupted very dramatically and drastically. So it has affected our sense of connection, sense of isolation. All these things affected our lives and livelihoods, as well as celebration of milestones. And again, the one thing, like every challenge, every dark cloud has a silver lining. We got better with this kind of media, like Zoom meetings. Before pandemic, Zoom is just a lens on the camera. Now Zoom is a different meaning.
Absolutely.
So Zoom is a meeting platform. So we have gotten closer together. In some ways, technology has improved, but also technology has divided us. Technology has caused a lot of disruption in our lives. A lot of misinformation is being spread out virally, causing a lot of ignorance and a lot of division among our people. So we need to use our technology. Like you can see, one of the poster I have behind is technology is dividing us. We need to protect ourselves from being divided by the technology. We need to use the technology to bring us together.
So talking
And
about
these are the important factors.
absolutely, and you mentioned about the effective use of Zoom. So very few people have remained camera shy as they used to be. Because now you are always there, but we still have some call it shyness when the need to consult a psychiatrist arises. As I grew up in India, I didn't come across anyone I knew who would have consulted any psychiatrist, or if they did, I never knew about it. So there is a sort of a stigma. Do you see that also plays for Indian Americans, even though they are in a different cultural setup, but they carry the same sort of a barrier that my friend would help my mother, sister, whosoever, but why go to a psychiatrist? So explain how important it is to be open for consultation.
That's a very good question. And again, there's another topic I have recently been looking at, the diaspora mental health. There are 40 million immigrants in this country, and they have 35 million children. So one quarter of the population is immigrant families. So their mental health has a significant impact on the societal well-being, as well as our economic prosperity. As we all know, as immigrants, we came here, we have a different mindset, we are risk taking, we are more outgoing, more extroverted people. But we come to from a one society, one culture to a different society and culture. Sometimes we live in a microcosm of our own culture and more own self-limited circumstances. But we're so focused on our success, material success sometimes, and professional success. Sometimes we don't take care of our mind and our wellness as well. And we expect our children to be like us, resilient, strong, not having any impact by the adversities. But the children are growing in a different culture. They're exposed to different culture outside the home, and they're exposed to different culture inside the house. So they're straddling two horses here. So we have to be very cognizant and very sensitive about our children's well-being. So they are kind of can be confused at times, and they can be conflicted about what are the values they're imbibing in, and how they're proceeding. So, and there is a taboo as a society, as a culture. We have taboos and our stigmas, and all these things affect our access to health. And we have lack of faith in systems sometimes, because we face discrimination, microaggression, communication barriers, acculturation issues, integration issues. All these things kind of make us a little bit kind of not very trusting of our systems here in this country. And so we need to break all these taboos. And also we tend to try to resolve our problems within our own family support system. Sometimes it works, sometimes it doesn't work. So you need to be aware of what resources are available, how you can culturally competently seek those resources, not isolate yourself and limit yourself to limited resources, only the family supporting you. Because we also, as a parents, tend to overprotect our children. We want to beyond age 18, we want to protect them financially, we want to protect them emotionally, psychologically, by providing guidance, advice, money, business opportunities, rather than let them grow on their own. So that can be positive or sometimes can be negative. So we need to be aware of our own barriers, our own mindsets, our own lack of kind of awareness to seek help, and resource limitations, access limitations, language communication barriers. So there are many factors that affect our access to care and willingness to seek help. So these are things, taboos, that as a community, as a media, as a person, as an NGO, as a physician, as a scientist, as a organization, we all have to advocate for eliminating the taboo and the stigma to access mental health care. That's part of this series. How to
Absolutely.
make people aware of mental health being very important, how to seek mental health at the right time in the right place.
And there could be some basic thumb rule, like pointers that you may share with our viewers as we move towards the concluding part of our conversation. But before that, allow me also to ask you, there are events that unfold in our lives which are traumatic, and they keep hovering and disturbing, whether you have come from a war zone or you have come from an experience of having lost a beloved person, husband, wife, son, daughter, father, and there is that trauma prevents you from moving forward in a healthy way. Also, I will add another scenario where you are undergoing a separation or you have separated. That is also traumatic. So I know these are different issues, but any general sort of sharing from you.
Yeah, that's another good question, and also another topic I've been paying attention to lately. There's something called post-trauma growth or post-traumatic growth. Trauma, stress can affect everybody, right? Like you said, the pandemic affects the whole entire globe under unprecedented stress and dislocation and disruption of our lives. And but it doesn't have to be a pandemic global stressor, but it could be a war zone, it could be a natural disaster, it could be a loss of a family member, it could be a disruption in your marriage, or a business loss, or just a sickness, or a loss of employment. These are all traumas that can affect you. And people can kind of be traumatized and have a post-traumatic stress disorder, or post after the stress and a traumatic event, people can regain the balance after struggling and come back to where they were. Or the third potential is post-traumatic growth, meaning you're better than you were before the trauma. For example, if your child died of a cancer, you not only become kind of sad and disillusioned at some point, but afterwards you can become active in fundraising and education about cancer and join organization. Or for example, if you have some kind of marital kind of spouse, your spouse dies and you remarry, sometimes you understand the value of marriage and relationship better now, before after the trauma of losing a first spouse. So these are the things that can change your personality and your view of life. Post-traumatic growth is a concept that was described by uh, Robert Tedeschi and Calhoun in University of North Carolina, Charlotte. They characterize it by 5 factors. One is you have better appreciation of life after some trauma, and better relationship with your family or your friends. And third thing, you understand your own potentials better. You're aware of your own strengths better now. And fourth is you embrace newer opportunities, newer challenges more openly. And fifth is the spirituality. You become more spiritual. These 5 elements, if you kind of focus on during this trauma, you can become post traumatically better, stronger. So, trauma doesn't have to cause disruption and disease and syndromes of sickness, but actually wellness and well being and better as a human being and as a society. So, there's a concept in post traumatic growth that's really important that we can all achieve that.
Yeah. Doctor,
Most
as we just have a few 2 minutes to go, one, I would like to share my joy on the intelligent coincidence, call it, that API now is going to have you as president. And when the world need more focus on mental health, so there is going to be Dr. Ravi Kolli leading this important organization. And as we conclude, I think we need to do a series with you where we talk about fear and how one can improve resilience, etc. But as we conclude, your thoughts on the role of API as far as mental health issues are concerned in coming months and year.
Yeah, that's important. Good and concluding comment I would like to make is API, as you know, American Association of Physicians of Indian origin, a very strong physician organization, well respected in the corridors of power. We have 15,000 members. We represent close to 80,000 Indian origin physicians. We have 100 plus chapters. So we have an organization that is very well respected and very prominent socially and professionally. So, as the president of API in my year as the president, being a psychiatrist in Pittsburgh for the last 30 plus years, I want to focus on societal mental health as well as physician wellness because there's a lot of physician burnout happening. We all know that, especially during this time. So the physician wellness is very important. Advocating for physician autonomy, advocating for physician resources to be more available for physicians to kind of fulfill their potential and their obligations to society, and then also promote the mental health of societies by attacking the stigma and the taboo and the barriers and access to care and equity issues. These are the focus of my term as the president of API. Thank you for
Wonderful.
giving
I
me.
appreciate you sharing all this and joining us for Healthy You and API. I think there were some valuable insightful comments from you with, of course, your experience. Um, and I hope our viewers take advantage of the material that is available on media with your help. Wishing everyone harmonious and healthy life that includes physical and mental health, of course, both. So, with lots of good wishes to you, sir. Thank you.
Thank you very much. And I also want to just one more comment. My employer, Southwestern Pennsylvania Human Services, sponsored this talk. And I want to thank them and Kelly McCavitt, our CEO, for sponsoring my presentation for the community. Thank you. And we're recruiting physicians and psychiatrists. Please call me if you have any interest in becoming a psychiatrist for our organization. Thank you.
Wonderful. Thank you very much. So, once again, thanking Dr. Raviji and thanking all of you for being a part of this conversation. This is Shobhas. Namaste.